Hi, everyone. So thanks for joining our webcast today. We're going to talk about negotiating a higher study budget. I know the last couple of weeks we've reviewed a lot about patient recruitment strategies. Before that, we kind of talked about some business development strategies, how to bring in new studies. So now, kind of the end of this first series, we're going to be tying it all together with the finance side. And talk to you guys a little bit more about how to maximize the financial potential of every study that you work on. So we're going to go over a couple of things today. Definitely, as always, if you have any questions, feel free to send them in. We're happy to make this as interactive as possible. I'm going to go over kind of some strategies that you can utilize when you're negotiating a study budget. Kind of what kinds of things to look for, how to ask for certain things. We also have several materials that we can give over after the webinar, so please feel free to ask me afterwards if there's anything that you'd like me to share. So one of the major things, and things that I hear from sites most of the time is that, study budgets are becoming more and more difficult to negotiate. Whereas 10, 15 years ago, 20 years ago, budgets were much more reasonable. They were much fairer. They, were, a lot of those kind of costs that we all know about from sites, stuff like, pharmacy setups and, time spent learning the protocol and setting up for the study. All of those costs typically were included in these budgets. Now you have to ask for them, and now you have to, it's really about justifying your costs and making sure that you have a budget that's commensurate with the work that you actually want to do. So a couple of things to keep in mind when it comes to contracts and budgets. Making sure that everything that you do is covered by the budget. So it sounds kind of simple, but some of the sites that we work with, sometimes they don't realize that the cost associated with something is not just associated with the actual physical cost of the procedure. It also is the time that it takes. So if a procedure has to involve a doctor or has to involve some sort of specialist or even a coordinator or any kind of support staff, that's all time. Those are salaries that you're paying. So when you're going through justifications, which we'll go over in this session as well, when you go through those justifications, you have to include the time spent for your staff essentially as well. Making sure that you're doing your due diligence when pricing up the budget. You want to make sure that you really are thinking about all aspects of the budget. And what I mean by that is, a lot of times we see sponsors that will send over a budget, first offer for a study, and they say, all right, I'm going to give you $1,000 for visit 1, $2,000 for visit 2, $1,500 for visit 3, so on and so forth. Instead of going and saying, oh, well, I want $1,500 on visit 1 instead of $1,000 on visit 1, and, going back and saying, those are my costs, that's what I need to stay afloat. What we suggest is actually going through the protocol, making sure that everything that you have, that you're going to be doing for the protocol, I should say, everything is being covered by that budget. Now, how do you do that? What you have to actually do is go through and make up that procedural template for each study. So what I mean by that is you're going to want to go through, and so for visit 1, you're going to want to write out every procedure that is involved, in visit 1. Then you're going to want to write out every procedure that's involved in visit 2, so on and so forth, so that when you're actually pricing up the budget, you're giving the sponsor your actual cost for those different procedures for those visits. So now when you go and say, I need $1,500 for visit 1, now you can justify because, well, that MRI is going to cost me this. Time that the doctor is going to have to meet with the patient to go over informed consent, that's going to cost me this based on the salary of the doctor. So it really is important to make sure that you kind of do your due diligence when it comes to pricing up the budget, and, spend the time, because it is, important based on how much you're going to make on each of these studies. We do have, if anybody's interested, kind of sample budget templates on how we, would price up a budget. So if, for example, we get some kind of a visit breakdown like that, we'd be happy to provide that as well, how we break out a budget. We have different Excel templates where, you put in the amounts that you need for each of the procedures, and it will show across all of the visits. And we have different formulas we can use depending on the different types of studies. So we're happy to share any of that if anybody is interested. Another thing that's really important when it comes to negotiating a budget is really making sure that you are, developing a relationship with sponsors and CROs, making sure that you are getting back to them very quickly. You guys might be surprised, some of you guys on the line, thinking, oh, well, I always get back, if I have a budget, I make sure I get back within a few days, and, and everything is great. And if you do that, that's awesome. However, we've worked with sites in the past where, we've seen that it might take 2, 3, 4, 5, 6 months to negotiate a budget. When that happens, the sponsors get very, very annoyed. They're less likely to, want to work with you to increase the budget. So really developing that relationship is going to help you on that study to get the better budget, and ultimately, of course, help you to land better budgets on future studies. Another tip that I have as far as kind of negotiating a budget is to think big picture. And this is another thing that we see with sites very often, where they'll say, I need my fee for this procedure or this startup cost, to be this amount. I won't do a study unless the startup cost is $8,000 or more. Well, every once in a while, as everybody here knows, you have that sponsor that doesn't matter how many times you justify it, how many times you talk to them, they're not going to give you the startup costs that you need. That being said, we always advise to really think big picture when it comes to your budget. If you can't get anything on one item, but you can get a lot more on another line item, that's something that you can work out kind of internal accounting wise based on, invoicing the sponsor and getting kind of the full bucket of funds from the sponsor. So really think big picture when you're thinking, is this a study that I should take? Because otherwise you may end up missing out on a study that could actually be very profitable for you and ultimately a good option for the patients in your clinic. So another thing that I wanted to kind of go over a little bit more is to really think about, making sure that you're not kind of, lowballing yourself. And what I mean by that is you want to make sure that you're not. It's one thing that's tough when it comes to budgets, and a lot of sites have actually come to me and said this, is to make sure that you're not, being hurt by other sites. And what I mean by that is sometimes sites will go in and they'll approve a low budget because they say, I want the study. They won't negotiate it. They won't, kind of make sure that they have the costs that they need covered. The problem with that is it's kind of one of those, might not be a problem today thing, but as, sites do that over and over again, you may see problems later on. So the problems that you might see would be, the sponsor saying, oh, well, this site approved a low budget, so why wouldn't these other sites approve a low budget? So, and it's tough to really, reach every site, in the country about this, or in the world about this, I should say. But really think about that when you're approving a budget. Fight for what you think that you should get, and fight for, use the justifications that, that you need in order to get the budget that you need, so that you can, so that, you're not kind of hurting, yourself and, potentially other sites in the industry, later on. Another thing, that you can really do is make sure that, you are going through the full process when it comes to this, negotiation, making sure that you are going back to the sponsor if needed. And what I mean by that is, we do work with some sites where they'll say, okay, once we get to this point, or this budget came out, it looks great, I don't need to negotiate it. Or you get to that point where, you do negotiate and the sponsor says, actually, you know what? I don't want to work with you guys because, I can do it with another site for cheaper. So if you don't accept this offer, we're going to drop you from the study. One thing that a lot of sites are scared away by that, and rightfully so. If a sponsor says, hey, I'm going to pull you from the study if you don't agree to this budget, they're kind of backed into a corner. They feel like they're backed into a corner. I can't do this, so, what am I going to do? What we found is, it is a very common tactic that sponsors will use, and they'll say, we're not going to work with you, too much out of our budget. Try to get a phone conversation and talk to them about your costs. Really justify it, because 9 times out of 10, when we are negotiating a budget and we get that, that notice from a sponsor or a CRO saying, the sponsor won't approve this, the sponsor is telling me that I need to drop you from the study if you don't approve this budget, definitely go after, try to ask, try to, really, try to, schedule a call and try to talk through your justifications. Otherwise, you may, again, end up kind of undercutting yourself when it comes to the budget. Definitely, there is a point at which some sponsors may not move forward, but you want to make sure that you get to that actual point, not the point that they necessarily say it is, because most of the time it's kind of past that initial point. Make sure that you kind of clarify all the odds and ends with the budget as well. So everything from, diagnostic tests, our vendor is going to be used. If it's a neurology study with kind of imaging involved, is there an MRI vendor, some sort of, other costs that's going to be needed, making sure that you know what those costs are so that when you're going back to the sponsor, you're able to, be covered for those costs. So make sure you know what's in the protocol when you're negotiating it. We were working with a budget a couple of years ago where, a site kind of was working with us. They started negotiating the budget, and then we came in and said, well, wait a second, you're negotiating the budget, but in the protocol here, it says that there's an imaging requirement. So make sure that you have that, that vendor cost covered, whether it's by receipt, by a flat amount, whatever it might be. Otherwise, you're going to be upside down on that piece. So definitely make sure to keep that in mind. And, as we talked about before, definitely make sure that you're reviewing the protocol in full and reviewing everything in detail before moving forward with the budget. Lab, another area that sites typically ask us about. Making sure, is there a central lab or is there a local lab? Obviously, if there's a local lab, that goes back to that vendor question again. Is there some sort of contracting that needs to take place in order to, to complete the requirements of the study? If there's a central lab, what lab kits are being provided? Is there anything else that needs to be purchased, or is everything being provided and processed, at that central lab? Any kind of equipment needed? Remember, we've worked with sponsors where, maybe we don't have the equipment necessary for a study, but they may cover the cost of us renting that equipment or even buying that equipment. It really depends, and it doesn't hurt to ask. So definitely make sure that if there are any of those requirements that you don't have, that you're making sure that the sponsor, or at least trying to make sure that the sponsor would cover that. Rescue medications, any other, kind of odds and ends that might be needed with the study that all of us know based on kind of our experience with these clinical studies. Just definitely make sure that you have kind of all of that in mind as you're working through, creating the budget. So make sure, getting down to, once you've kind of gotten that full picture of everything that you need to have in the budget, you go through the protocol, you build out the procedural breakdown, you start pricing up the budget. Make sure that you go, kind of as high as you can, obviously reasonably, but start high. Don't kind of start where you want to be. Start a little bit, say 20, 25% higher than you want to be. Because if you start there, you're going to negotiate down to where you need to be. include your overhead amounts, make sure to include a patient stipend. I've seen a lot of budgets lately where sponsors are kind of leaving out the patient stipend. So definitely make sure that we're adding that back in if it's not there. We're making sure that the stipend is, kind of commensurate with the procedures that the patients are going to be exposed to, the time that the patients are going to be there. So just make sure that all of those things are, are included. If it's a visit where the patient is going to be there, for, a full day, 7 hours, 8 hours, remember that, especially depending on the age range of the study, the patients may be, not, missing work for a study. So keep that in mind when, trying to recruit patients. How are we going to get them to the site if, maybe they, are losing money on that, if, they are at a job where they can't take a vacation day, or if it's a study where there's, several visits. Just kind of keep that in mind when it comes to the patient stipend. And also, kind of showing the sponsors too that you understand those time points and making it kind of variable across the study. So what I mean by that is if you're working on a budget template for a study and you see that, the first couple of visits, it's very involved with the patient. They're involved in a lot of procedures. They're there for an extended period of time. But later on, they may come in for, a check-in, for an hour to do a couple of scales or, a much less intense visit on the patient. Go to the sponsor and say, I need a lot more for, these first couple of visits, but then those last couple of visits, maybe you need a little bit less. And that will also show them that, you're not just trying to squeeze as much money out of them as possible, which I know none of you guys would ever want to do that. But when you do that, you want to make sure that they understand that you understand the protocol, that that, okay, this is what's needed at the beginning, but at the end, it's not as labor intensive for the patient and it's not as labor intensive for us. So keep that in mind as well as a, kind of a strategy when it comes to something like that. We do also have, I know if you guys have been on any of my other kind of finance webinars, and I think I've shown this before, but we do have a kind of, spreadsheet of a lot of, kind of standard costs and things that we've seen that have worked for different procedures and everything. If anybody has any specific questions about certain procedures or events that happen in studies that you are familiar or you want kind of some advice on how much you think you can get for it, definitely let me know. I'd be happy to share some of that information as well. Another thing, we kind of already hit on this a little bit, but I do want to go back to it. Startup costs and fees, pass-through fees. There's a lot of different pass-through fees that that you can ask for, there's definitely, we have a list that we typically negotiate in our budgets that's I don't know, 25 long, the purpose of this is again really trying to make sure that we're covering ourselves for every study that we, for every procedure and all of the time that we're spending on each study. So we break our pass-through fees into two categories. So we call them our pass-through fees, and then our second category would be our contingency pass-through fees. So the first section, the pass-through fees, are all of the items that we know are going to happen in a study. That's your startup. That's your pharmacy setup. That's your archiving. All of the things we know are going to happen. Investigator meeting. Remember, that's time that the PI, maybe a coordinator, maybe both, maybe a rater. That's time that they have to be out of the office, making sure that, you're getting paid for that. Not just that the sponsor is covering the hotel room and food, but that you're getting paid for the time that that doctor is out of the office and not able to see other patients. Things like, study closeout, things like that. Those are the things that go into that pass-through item. Then you have what are called kind of the contingency pass-through items, which we put into every budget up front. And the reason why we want to put this up front is to make sure that we're covered when these things happen. That could be anything from a not-for-cause audit fee, an SAE fee, something like a monitor change fee, So as we all know from the site side, if the monitor changes halfway through a study, which we all know happens quite a bit, you have to reorient that monitor to the site, reorient them to the monitor space, show them where all the binders are, kind of show them, how, your study site SOPs, all of those different pieces. That takes time out of the coordinator's day. Those are things, you should be paid at some kind of a rate for that. Things like advertising, of course, goes into that non-pass, contingency pass-through fees. A lot of times we try to throw that into kind of the direct pass-through fees, but sometimes, depending on the sponsor, it might be a strategy to get them to kind of approve a bigger amount based on, submitting invoices and all of those different pieces. So there's a whole list that we can go through of all different types of pass-throughs that we've utilized in the past. But definitely, if anybody has any questions on those, feel free to shoot them over. When it comes to pass-throughs, one other item that I want to just kind of quickly touch on are your diagnostic tests. So kind of a pass-through, kind of not. One thing that we've seen that helps us to, sometimes sponsors will basically look at the number and they'll say, oh, well, your per patient number is 12,000. Your per patient number is 10,000. And that's all in their mind. They have a number that I need to get this to 7,500 or less. Well, one strategy that you can utilize is you can actually pull your diagnostic fees out. So your diagnostic test. So things like your, x-rays and scans and, things like that, you can pull that out of your per patient budget. Obviously, then it's not in your overhead. And then you can basically decrease that per patient cost, but still have it, in that, direct pass-through type of section. So it's just something we've seen as a, kind of a way to get around, kind of increasing the budget as best as possible, making sure we're still kind of covering our costs. If anybody has any questions, definitely feel free to send them over as well. Definitely want to answer any questions that you have as we kind of get towards the end of this. One last thing that I want to go over is screen failures. So this is always kind of one of the most important parts of a budget negotiation, making sure that we're being covered for screen failure. We want to try to, use this again as a, kind of do more of a negotiation with this to make sure that you guys are as covered as possible. Ultimately, the best case scenario is, of course, being covered for all screen fails. Now, a lot of sponsors don't like to do that based on making sure that, they're not getting sites that are screen failing patients and not randomizing patients, and then the sponsor is basically paying the site out for, data that they, don't need. So what the first, kind of take this in 3 steps. First and foremost, you want to get all screen fails. All procedures should be compensated at the full cost of the visit. Sponsors don't go for that, and sometimes they do, but most of the time they don't. Try to go for, a cap. So if you're pretty confident based on the inclusion-exclusion that you're going to, your screen fails are going to end up in a, certain range, go for a cap. Say, okay, I'll be reimbursed for all screen fails up to 10. So the first 10 screen fails, you're paid for every procedure that the patient undergoes, and then you're completely covered. Then maybe they say, no, we can't do that. That, doesn't make sense. Then you can go to a ratio. And again, make sure that the ratio, makes sense based on what you, what you feel the screen fail ratio is going to be, or what the sponsor has kind of advised that the screen fail ratio is going to be. Of course, go from best case for you, to, get to a point where you can kind of mutually agree, with the sponsor. So I hope that was helpful as far as, kind of some, initial, kind of tips as far as how to maximize your study budget. Next week, we're going to review a lot more on kind of receivable management. And, once you have the budget and you have the contract negotiated, how do you make sure that you're maximizing the receivable management side of of each study? And ultimately, I almost feel like that part is even more critical than this part, because as all of you guys know, as you continue to, move forward through a study, different unanticipated costs come up. The work you do may not be commensurate with the work that was initially negotiated in the budget, which may lead to renegotiations. So really having a tracking system in order to manage your receivables is going to be super crucial to make sure that you're maximizing the financial potential of every study. So it looks like I have one question coming in here, which I will answer quickly before we wrap up here. So the one question I have here is, what do you do when a sponsor comes to you and says, that's great, your offer is great, but that's not fair market value, and I need to stick to fair market value? That's an excellent question, because it's something that we definitely see very, very often. And it all comes down again to that justification. So if you can come back and justify that that procedure is going to cost this much based on the actual physical cost of it, the time spent by the staff members that are, involved in it, and really come back with that, that's how we've been able to sort of get around that very common comeback that we get from a sponsor. One quick example that I'll give you is we were negotiating a neurology study about 2 years ago. And this was a complicated, I believe it was an Alzheimer's study, where there were a lot of rating scales. It was very complicated. And what we did is we went out, and I think the initial offer for the startup was something like $6,000 or something. And it just didn't cover, it was one of those really, really tough Alzheimer's studies. So I think we asked for something like $12,000 or $15,000. And the sponsor basically came back and said, absolutely not. We're going to give you the $6,000 that we set out to give you. That's it. So we said, okay, let's try this. So we put together a 2-page PDF with the letterhead of the site at the top, basically stating, okay, these are all of the things that we're going to go for, that we're going to need in order for, this startup to cover our costs. And so we had a 2-page document basically, indicating everything that startup was going to. We ended up, and I think we were negotiating with the CRO, we ended up escalating it to the sponsor, and we literally went over line by line on that. Okay, this is what this is going to. These are the staff members involved. This is the time this takes. We really need this amount. And they ended up approving it. So I like to give that example just based on, to kind of summarize everything we're talking about here. It's really important to make sure that you are, really taking the time to maximize each of these budgets and really taking the time to justify your costs. So when a sponsor comes back and says, oh, that's not fair market value, or, oh, if you come back at us one more time, we're going to drop you from the study. Really think about, how we're justifying ourselves. And remember, at the end of the day, a sponsor that drops the site from a study is going to be paying a lot more than they would pay to give, a site a couple extra $1,000. That's all I have for today. Definitely feel free to email me at Scott, SCOTT, @btcsite.com if you have any further questions, or if you want to kind of chat about this a little bit further. Other than that, we'll see you next week. Bye.